Here we have the adult human skull. The coronal suture here is the back posterior-most portion of the frontal bone. The frontal bone is going to be what makes up your forehead, top and front of your skull. On the frontal bone, components that we can see are this area here in between the two orbits, in between the eye sockets. This would be kind of like the unibrow area. This is called the glabella. And then we have the top line here of the orbit. This is called the supraorbital margin. Supra means above, and this is the orbit. So supraorbital is talking about above or the top of the orbit. Margin is referring to the entire edge line. So this whole top line of the orbit is the supraorbital margin. As we go to the medial aspect, closer to the nose, we can see this little notch here on both sides. On some pictures and in some models, it might be a hole, some it might be a notch. This is the supraorbital foramen or supraorbital notch. They are pretty much interchangeable, and depending on what book you're looking at, what picture, what model, sometimes it's a notch and sometimes it's a hole. Foramen would mean a hole. Along the top of the skull here, we can see the parietal bones. There are two. There is a right and a left parietal bone. The parietal bones are completely enclosed by all of the sutures. So you can see the squamosal suture on the side here as the lateral edge, the coronal suture as the front anterior edge, the sagittal suture separating the right and the left, and then you have that lambdoidal suture in the back most border edge there. So that all those sutures are going to outline each parietal bone. Then we have the back of the skull. This is the occipital bone here. This is the back and some of the bottom of the skull. On the occipital bone, we can see this protrusion here. You can also feel this on the back of your own skull. There should be a small little bump there. That is the external occipital protuberance. This is where your trapezius or neck muscle attaches to, which holds up your head. So if your head's constantly down like this, this protuberance is going to constantly be pulled on, and this is actually starting to grow in some people, especially those that always have their head down looking at their phones. As we turn a little bit more towards the underside, you can see it kind of looks like a pinched in space here, like somebody took their fingers and pinched it a little bit. This ridge line right down the midline is called the external occipital crest. Both of these have external occipital in them because they are both on the external surface of the occipital bone. Protuberance protrudes out. Crest is kind of like the top of a wave, or the topmost portion of a ridge line. So you can see the top of the ridge here is the crest. The crest is going to take us to this large hole on the bottom of your skull. This is called the foramen magnum. This is where the spinal cord will come through. So your brain will be in the skull, and then the spinal cord will come out of the skull and down the vertebrae through this foramen magnum. Foramen means hole, magnum means large. So it just means large hole in Latin. On either side of that foramen magnum, we can see these raised edges. Anytime you have a rounded projection that forms a joint, that is called a condyle. Because these are on the occipital bone, they are called occipital condyles. These are going to form the first joint with the first vertebrae, which I will grab here. This is the first vertebrae here. So this is going to sit on top. Those condyles will sit in those little grooves. And then you can see the head will be able to kind of rock up and down inside of these little grooves, allowing for that up, down, yes, no motion. But again, you can see these rounded projections on either side. And those are the occipital condyles, condyle forming a joint. For the hypoglossal canal, we have to take, on these models, we have to take the top of the skull off, those parietal bones. And we can look down into the skull and we can again see that foramen magnum here. On either side of the foramen magnum, there's going to be somewhat of a smaller hole, somewhat more towards the front of the foramen magnum. Those are the hypoglossal canals. Hypoglossal is a cranial nerve. It's the 12th cranial nerve that comes off of your brain. Hypo means below, glosso means tongue. So when I stick the pointer through here, you can see how it kind of comes out and would go to the lower part of the mouth here, under the tongue. So hypoglossal, below the tongue. So again, just to review those, we have our frontal bone with the glabella, supraorbital margin, supraorbital notch or foramen, parietal bones, occipital bone, external occipital protuberance, external occipital crest, foramen magnum, occipital condyles, and the hypoglossal canals.